Hello, everyone. This is Zohir Chaudhary, and it's a pleasure to be here. Today, we'll talk about public health surveillance. So, the term surveillance comes from a French word meaning to watch over. And what typically comes to your mind when you hear the word surveillance? So, typically, law enforcement surveillance systems, that's what comes first to mind, such as the police surveillance, FBI surveillance, or the CIA surveillance in the United States, or other types of surveillance in other countries. And also, surveillance, when we hear it, it would mean to us like a routine data collection, such as statistics and trends of with that data. In public health, on the other hand, the term surveillance was defined both by the WHO and the CDC, the two main bodies that use public surveillance systems. So let's look at how these two organizations define public health surveillance. So the first one, CDC. So according to the CDC, and this definition was adopted from Trucker and Burkhead. So the surveillance is the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this health data to those responsible for prevention and control. Pay particular attention to the red-colored text. On the other hand, WHO defines public health surveillance is the continuous and systematic collection, orderly consolidation, and evaluation of pertinent data, prompt dissemination of results to those who need to know, particularly those who are in a position to take action. There have been three developments in that conception of the definition of surveillance. First, the original concept development was the watching and confinement to the surveillance of epidemic diseases in population during the mid 20th century. Second, the original concept development was the watching and confinement of individual cases of highly communicable diseases responsible for devastating epidemic, in particular smallpox and yellow fever. The watchfulness then moved from individual to the surveillance of epidemic diseases in population later on. And then the concept of public health action was clearly attached to surveillance. Action is what distinguishes surveillance from the task of simply monitoring events. Donald Henderson, who was instrumental in the eradication of smallpox in the 1970s, once described surveillance as the neurologic system of public health. Surveillance, the eyes and ears of public health, provides information through which public health programs can act effectively and efficiently. Controlling and preventing diseases based on information collected through surveillance requires action. In some cases, action must be immediate, within hours, in order to prevent large-scale epidemics and death. For instance, from cholera, Ebola, or food contamination when they occur. In other cases, control and prevention activities are long-term responses to information about diseases, such as tuberculosis, AIDS, malaria, and non-communicable diseases such as diabetes and hypertension. In such cases, action may be within days, weeks, or years. So let's break down the definition and examine the words. Surveillance is ongoing and systematic, collection, analysis, interpretation, and dissemination of health-related data. And the final link in the surveillance chain is the application of this data to prevention and control so health action can be taken. A surveillance system includes a functional capacity for data collection, analysis, and dissemination linked to public health programs such as health planning, disease control, and prevention and/or health promotion. The concept of public health surveillance has evolved over time and is still confused with other uses of the term surveillance. The current concept of surveillance as the monitoring of disease occurrence in population was promoted by Dr. Alexander Langmuir as a function of the newly created Communicable Disease Center, now known as the CDC, Center for Disease Control and Prevention. Before that, surveillance had meant the close observation of persons who had been exposed to a communicable disease in order to detect early symptoms and to institute prompt isolation and control measures. To distinguish between these two surveillance activities, we now use public health surveillance to describe monitoring health events in population and use the term medical surveillance to describe monitoring potentially exposed individuals to detect early symptoms. Surveillance is a key component of public health in conjunction with epidemiology, public health laboratories, public health informatics, prevention and effectiveness. Surveillance can help us protect and promote the health of the public by giving public health practitioners the answers that they need. One component alone cannot answer the questions and provide solution. It's the application of these components together that ensures a successful response. During the COVID-19 pandemic, surveillance played a prominent role in government's efforts. During this time, local, state, and federal governments used disease surveillance to help make decisions for public safety, as well as to monitor community cases to understand the spread of the disease. The CDC has created several different COVID-19 related surveillance systems. One such example is the COVID-19 data tracker, which was also reported internationally from the United States. It consisted of a daily update on the number of COVID-19 cases, death, hospitalization, and COVID-19 vaccinations at the national, state, and county level. This information includes both new events and the total. And that's one good example of a surveillance. Another example of surveillance is the public health surveillance of COVID-19 in the wastewater system. So wastewater surveillance monitors the presence of the virus in the wastewater in a county by testing for SARS-CoV-2 virus in treatment facilities where wastewater in the wastewater samples and reporting it to the public health agencies. So I hope that these two examples provided you an idea of public health surveillance. Thanks.